How you doing, my friend?
I'm doing well, man. I'm doing
Just
well.
had said
I
hello to,
survived yesterday.
I just had a conversation to say hello to your boss who's on.
Oh, my, my yeah, yes.
Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We're happy that you chose to join us. And in a way, I feel like it's going down memory lane as I burst into my college years and marijuana was bursting on the scene, at least on the East Coast. I guess it had already been on the West Coast. And
Mm.
here we are today talking about it I won't say how many, but these many years later. So without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Well, thank you very much, Dr. Barbara David Stevens. Thank you, Dr. Ivan Walks, Dr. Jocelyn Hines, and Dr. Lawson for joining, and Simon for working with us. Had a great day yesterday. I went and was a guest at a ceremony for medical students in East Jesus, California, and they had a ceremony program in honor of Dr. Ivan Walks. And I was there in the audience and I had my rotten tomatoes ready, but he was so good that I didn't throw one rotten tomato or egg at him. He was so good and inspired me and all the people there. And I'm very proud to be associated with Dr. Ivan Walks. It was great. So we're going to talk about a subject, as Dr. Neighbor Stevens said, that's been around for a while. Simon, if you put up the first slides. So Ivan, I went to church today, and he said that God is not the author of confusion. That it's important that we have wholeness and we stay together in our homes, our hearts, and our families. And he preached on that. So cannabis or marijuana, it has benefits, risks, and real world uses in some cases. Next slide. So why its use is increasing? One, it's become legalized across many states in the United States. It has increased availability. You can get it at dispensaries, you can get it online, and also it has the perception of being safe. It has uses for pain, for assistance in sleep and anxiety, and its medical influence, uh, such as people like Dr. Sanjay Gupta has presented at least 7 or 8 documentaries seeing how good it is, especially with things like seizures. Next slide. Dr. Barbara David Stevens.
So what is cannabis? It's a plant that contains active compounds. The ones that we're most concerned about are the cannabinoids. THC is the one that gives the psychoactive high. CBD is non-intoxicating, and then there are over 100 others that have been identified.
Dr. Walsh.
Common types in community terms. There's green, which is the typical marijuana flower. There is gold, which is the high potency concentrates, also known as wax and shatter. There is black, hashish or resin-based forms. There's kush, OG, strain families. There's gas, which is strong smelling, potent cannabis, and then the exotics, the high-end cultivated strains.
Next slide, Dr. Hines.
So different forms of cannabis so for smoking, flowers, joints, blunts, then you've got vaping, you have edibles. Edibles can be gummies, baked goods. You also have oils and tinctures and concentrates such as wax, shatter, or dabs.
There are also drinks. You can get, at least in Nashville, you can get canned cannabis drinks.
Okay, is that Lawson on?
Yeah,
Next slide, take the next
yeah.
slide.
I just want to make full disclosure. I was involved in among the first studies demonstrating that marijuana can in fact increase the risk of schizophrenia and certain other psychotic disorders. In addition, I was involved with our current Health and Human Services Director in terms of demonstrations to limit the use of it in the district. In terms of THC effects, it's euphoria, relaxation, altered perception, increased appetite, impaired memory and coordination. And you say anxiety or paranoia in some users. What we found, it wasn't just anxiety or paranoia. If you had certain risk genes that exist for schizophrenia and bipolar disorder, which unfortunately are fairly common in the population, you can in fact induce frank psychosis or manic episodes.
Thank you. Next slide. So we think that cannabis is something new, but it is a very historical use. A more than 4,000 year pathway has been presented of the use of marijuana. Next slide. Take the next two slides, Dr. Neighbors-Evans.
Cannabis has been used across civilizations for medicine, rituals, and a source of income through industry. Ancient China in 2700 before Christ. I've not known what the E is for when that BCE shows up, but before Christ something. It has been attributed to Shennong, used for pain, treating malaria and rheumatism, and hemp was used for textiles and paper.
Take the next one too.
China's clinical insight showed that early recognition of anti-inflammatory and analgesic effects.
Take one more.
In ancient Egypt, between 1500 and 1000 BCE, marijuana was sacred in Vedic traditions. It was associated with Shiva and consumed as hang.
Next slide, Dr. Walks.
In India, it had medical uses. So it was used for anxiety relief, used as a digestive aid, and used for pain management.
Take the next two.
Okay. And in ancient Egypt, 1500 BCE, it was referenced in the Ebers Papyrus, used for eye inflammation and pain. And then in Egypt was clinical insight, topical, anti-inflammatory, and antimicrobial use.
One more.
Okay. Greece and Rome, 500 BCE to 200 BCE, described by Dioscorides and used for ear pain and inflammation.
That hand, take the next three if you would.
Hemp was used for ropes and sails with the Greeks and the Romans, as well as it was critical to naval systems. In the Middle East and Persia, it is described by Herodotus. It was used in steam baths and inhalation rituals. Additionally, in the Middle East, it was used for early inhalation delivery, similar to vaporization for clinical purposes.
Dr. Lawson.
Ancient Africa, used in Ethiopia and Central/Southern Africa. It was used for pain relief and appetite stimulation. It's why we're still using, some of us use for.
Yeah, take the next two if you would.
Africa cultural uses, spiritual and ritual healing applications. And the routes of administration is orally, but through drinks, topical, through ointments, inhalation, through smoke and steam.
So therapeutic themes, we know it's used for pain relief, inflammation control, neurological symptom management as well. Next slide. So there's a medical and spiritual role. It's dual use in healing and religious practices as well. Next slide. So more modern times, we know it's used in historical senses, but it also aligns with modern research in pain, epilepsy, and nausea. And Dr. Sanjay Gupta presented several things that in certain types of epilepsy, it can be curative, especially for young children who have status epilepticus. Next slide. Dr. Neighbor-Stevens?
Limitations of ancient use. There were no dosing standards, no clinical trials, and variable safety. And I might add, now, as then, there was no quality control.
Take the next two if you would.
Conclusion. Cannabis has a long global history. Modern medicine is refining its safe use. CBD effects. No high. May reduce anxiety. Has anti-inflammatory properties. Used in seizure disorders and variable evidence for other uses.
Dr. Walks?
Potential medical benefits: chronic pain relief, nausea resulting from chemotherapy, appetite, stimulation, certain seizure disorders, sleep improvement in the short term.
Take the next two and then we'll go to Dr. Hines.
Okay. Risks and side effects: addiction, also called cannabis use disorder, impaired driving, cognitive impairment, anxiety, paranoia, and psychosis, as Dr. Lawson talked about earlier, and then also cardiovascular strain. Special populations: the elderly. There is a fall risk and an increased risk of confusion. With adolescents, there is a concern about brain development. And then in pregnancy, there is a fetal risk. And with cardiac patients, there is an arrhythmia risk.
Hey, can we spend a little bit of time discussing these things on this slide? Dr. Neighbor-Stevens, especially what's the problem with children and adolescents and brain development, and everybody else chip in on that?
Well, the short version of the story is that adolescent brains are still developing. In fact, the human brain is thought to continue development through 21, and some people a little later than that. And the concern is that the use of marijuana in individuals, adolescents particularly, will interfere with some of the later executive functional development in that we see in adolescence.
What's your input on this, Dr. Walks, and Dr. Lawson, Dr. Hines?
Well, I just want to note that the big problem in terms of risk for psychosis is that if you use it after adolescence, the risk of developing psychosis is much, much less. But if you start using it during adolescence, or if the person has strong family history of schizophrenia, bipolar disorder, it's a very, very real problem that you can produce something like good old idiopathic schizophrenia or bipolar disorder.
So I'll chime in on the elderly fall risk and confusion point. Anything that impairs accurate proprioception, perception of where you are and where your body is in space, is absolutely dangerous for folks who are elderly and may not be able to react and regain balance as quickly as folks who are younger. And when you combine that with so much promotion of marijuana use in the elderly for any number of conditions, and just the term conditions is a term that's used not as much when you're 30, and a whole lot more conditions tend to visit us when we get to be 60, 70, and 80 and 90. And so we have more conditions that somebody says, oh, so marijuana may help, and now we are less able to protect ourselves. I am fond of saying that falls are only for toddlers. If you are over the age of 3, you should not be falling down.
There
And
you
this whole, I'm sorry, Dr. Maxey,
go. I said,
you
there
can
you
still
go.
fall down. Okay. All right. Oh, so that's what I got. I just think it's important that when we are doing something to help someone or talking about something to help someone, we will talk about the side effects from a biological or biochemical perspective. And sometimes we don't spend as much time on the things that are really very, very dangerous. Falling down is one of the most dangerous things that you can do as an elderly person.
Dr. Hines?
Yeah, I was going to comment on the arrhythmia risk issue. So for cardiac patients, especially people who have a history of any type of irregular heartbeat, including the ones that might be benign under normal circumstances, there is a link between cannabis use and atrial fibrillation, ventricular fibrillation. It is still being fully researched, but the understanding is around the effect that cannabis has on the receptors that deal with the electrolytes in your heart, and that is likely to be one of the etiologies behind it. There's also the ways that your central nervous system, and in particular your autonomic nervous system, that's that whole fight or flight part of your nervous system, that is impacted by cannabis use, and that can also play a role in the heart rate and heart rhythm issues. So there are lots in the movies, you see lots of jokes around people when they're high and they're like, feeling their heart pounding and those kinds of things. So that there could be some truth to some of the things that we joke about. And when we're talking about increased use and the ubiquitousness with which we can find these things, you just have to be really careful about some of the things that we're using.
There's an almost pathognomonic rhythm called paroxysmal atrial tachycardia, PAT, that comes in, and you treat it by massaging the carotid nodes to get it done. So we know that person has probably been smoking pot. And also we know that there's a risk to the fetus in pregnancy, and it gets into breast milk when a mother may be nursing. So we need to have caution for all of those. We also know that it raises blood pressure a lot and has been known to show that heart attacks can be more frequent when you're high than sometimes. Next slide. Dr. Neighbor-Stephens.
Cannabis in the brain. Cannabis affects memory and attention. Long-term heavy use may impair cognition. There's an increased risk, as we've been discussing, in psychiatric disorders in vulnerable individuals.
Any comments on this one?
Well, I just want to note again that the operating term is increase in psychiatric disorders in vulnerable individuals. There's no practical way to determine who's a vulnerable individual, other than getting a very detailed family history. The genes, the risk genes for schizophrenia and bipolar disorder are simply not that information that is not available very much to the general population or the general practitioner. So unfortunately, had a case of 2 patients that had to be hospitalized in the past year because they got some CBD that had some THC in it, and they ended up having severe psychosis and had to be admitted. So it's an relatively uncommon but very real effect that impacts upon people that live for years of life.
Okay, on this slide, we know that cannabis can have certain effects on the heart that are negative. It causes increased heart rate, can go too fast, that's a paroxysmal atrial tachycardia, PAT. It also is like smoking regular cigarettes, that it causes endothelial contraction, which can cause your blood pressure to go up and fluctuate. It's also associated with myocardial infarction as well as stroke in certain high-risk patients. Next slide. You want to speak about this one, Dr. Walks? Dr. Lawson?
The addiction risk, 9 to 30% risk depending on age and frequency, higher risk in younger users, withdrawals, irritability, and sleep issues. And the addiction risk is not the kind of risk that you see in terms of opioid use. On the other hand, and I see it very similar to the kind you see in terms of gaming addiction and gambling addiction. Unfortunately, there is no medical treatment to treat the addiction problem, most in terms of some sort of contingency management or behavioral techniques.
Can you talk a minute about the cannabinoid system that's in the body? The endocannabinoid system?
Yeah, the receptors was interesting that we have receptors for cannabis, because what evolutionary function does it? And it's probably tied into the so-called appetitive pleasure centers, and helps again to give you reinforcements for when you eat and so forth. So there are receptors mostly in the limbic system and the hypothalamus, and also in the medulla area.
Okay, let's go to the next slide. Dr. Hines?
Drug interactions. So blood thinners, sedatives, antidepressants, various blood pressure medications can all have drug interactions with cannabis.
Dr. Maxey, I would also add anti-psychotics as well as many of the anti-seizure medications, or positive and negative.
And also with these blood thinners, and often can increase that, so you may have bleeding, increased strokes, and things with that, and may co-react with sedatives. So this is not to be played with. Next slide.
What the evidence says. So there is a strong correlation of clinical use regarding seizures and nausea from chemotherapy. There is moderate evidence regarding the efficacy with regard to chronic pain and multiple sclerosis and spasticity, or musculoskeletal spasticity, maybe?
Yes.
Yeah, musculoskeletal spasticity, sorry. And there is limited evidence with regard to using cannabis for anxiety, sleep, or as an anti-inflammatory.
I remember years ago, my father had glaucoma, and he was working with a guy named John, I can't think of his last name, but the first federal programs, they were passing out marijuana to reduce the eye pressure in glaucoma. So he was smoking this thing every night. My mama goes, "The devil's at work, the devil's at work." But it worked. It worked. Now they got drops that are better. Next slide. That's neighbor, Stephen.
So our clinical takeaways are: one, this is an individualized decision-making opportunity, the decision whether or not to engage in the use of cannabinoids. You have to really consider the comorbidities. You have to monitor the dose and the frequency. And people need to be educated on the risks that are associated. Like any drug, there are benefits and there are risks.
I think that's the last slide. Is that the last slide, Simon?
Public health.
Go do that one.
Public health perspective. There's a rising daily use. There's increased potency over time. There's a need for patient education. And there's a balance that needs to be assessed between benefits and risk.
Next slide. Go ahead.
Final summary, cannabis has real medical uses. Risks are often underestimated. THC versus CBD matters, and use should be done cautiously and under guidance. That is the medicinal uses.
Next slide. Okay. So in considering this, I know in modern days, people use edibles. And one of the dangers that I've seen in edibles, that once you eat it, you don't have any control. So you may not feel high or like you want to, but it may come hours later. If you keep eating it, you may have too much and actually overdose on that. So there's a lot of cautions that need to be taken with this. What are some other thoughts that some of us may have on the use of marijuana and its conteners and CBD?
Well, I think you just said something that we didn't really address before, and that is the whole issue of overdose. Because the pervasive thought is one, that it's not addictive, and two, that you can't overdose.
Well,
I will start it off by saying one of the things that I see regularly as I do my cases is a hyperemesis syndrome that I have to say seems to be mostly in young adults. I can't recall seeing one in an elderly person. I'm not saying it can't happen, but it's certainly not uncommon.
That's true. And Dr. Hines, do you ever see this in patients who have who can't eat, who have no appetite? Do you see it used in those cases?
Oh, I've seen both, right? So I've absolutely seen it used for and even given in like prescription and pill forms and stuff like that for people who have failure to thrive for any number of reasons. Um, and I've seen people get, reasonable benefit, reasonable results. And I've absolutely seen, especially when I was working in the ER, hyperemesis issues. And it's until you just said that, I don't think I had really realized that they were always young adults. And I thought that was anecdotal. I think the other real big myth that I think we kind of touched on with the drug interactions part in part is, it's natural, so it must therefore be harmless, right? Because things that happen that come in nature therefore have to be fine. And there's so many reasons why that's simply not true. And we touched on that with the interactions issue. The other thing that I hear and see a lot is that people use edibles because it's safer than smoking. And because you don't get some of the lung related issues that you think about, from smoking. But as you pointed out, there are absolutely issues with not just over intoxication, but anxiety, panic, emergency room visits, because people don't necessarily, know that they are getting cannabis products because you can put them in butters. People are baking with them. Like people talk about spaghetti, all kinds of stuff. People are putting cannabis laced products in, and sometimes for fun, right? Or
Hey, spaghetti.
yes, because you can put it in butter.
Wow.
Yep. So I'm familiar with someone who makes some apparently spaghetti and shrimp scampi. That is No.
Wow.
But again, it's like lots of things,
It-
right? You just don't, you may not know, and you may cause somebody harm, not meaning to, obviously, but you know, there's risk there.
Excellent. Uh, in fact, I'm a affiliated. One of my a lady's been a PA of mine for about 40 years. Has a product called Temple of Leaves, and it's cannabinoids in roll-on form for pain and things like that. So that's a good use for. I put it on some of my back pain. It helps. I mean, it won't get 4+ pain, but if you get 2+ pain, it might it might help topically.
Can I also just add to about just driving under the influence? We spent a lot of time talking about alcohol and driving under the influence, but there's not as nearly as much discourse around driving under the influence of marijuana. And similarly, you know, your reaction time, coordination, decision making, all of those things are impaired and increase your risk for crashing. But that doesn't get nearly as much press as some of the other intoxicating agents.
That's true, very true. Any other thoughts going around the horn?
Yeah, I just wanted to note, it's also widely used as a treatment for people with anorexia. And can
Why
be
did you
very
just
effective
say it again?
It's widely used for people with anorexia nervosa
Mm-hmm.
and very effective in doing that. But again, the same risk factor. A lot of folks presenting with anorexia nervosa may also have underlying psychotic disorders that may not be recognized. Also, Dr. Chapman, I don't know if he's online, but one of the things that we've seen locally is that people have put fentanyl in marijuana products. And as a result, that leads to all kinds of problems in terms of addictions and so forth. So again, some of the newer synthetic opioids can be and often are combined with cannabis products. And if the person is uninformed, they end up with a very difficult situation. And again, one of the patients I had that developed psychosis, she had taken what she thought was pure CBD, but in fact, that a combination of THC and fentanyl.
So, what's the best
So,
way if you want to use marijuana for medical use? Is it better to get it? Where is it dispensed? Is it dispensed in drugstores or dispensaries? What's the safest way to get it? Who knows?
The safest way is to get the super safest way to get is by prescription. But failing that, most of the at least in Maryland, most of the I found most of the dispensaries are pretty honest. What they found in Cincinnati and in Ohio is that that's not been the case. And again, the big problem is that what you're getting will almost certainly be on CBD, but the problem is that they sometimes do not exclude those problems with THC. And again, I'm talking about CBD and not just straight THC.
so let me add to what Dr. Lawson just mentioned. I remember being a kid, and that was not recently, when folks would talk about lacing their marijuana with something because there was uh, 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 some sort of a desire for an increased high or a different kind of high. And people have been putting stuff in marijuana cigarettes for as long as I can remember. People would put angel dust in and make and legitimately make people crazy. That was the only scientific term for it. It'd make people crazy. And now people are putting fentanyl in. And if you ever want to think about a substance that you cannot measure a safe amount of, it's fentanyl. You just can't measure what a safe amount is. And so I think either growing it yourself, as Dr. Lawson said, getting it by prescription from some sort of a regulated dispensary is really important, because the stuff they used to do back in the 70s by putting angel dust and stuff in it, oh, they're still doing that. It's just now you can get the marijuana to start with, and then you put the crazy stuff in there and bad things happen. So I just think it's important for us to remember that. I had a patient one time tell me, well, I know my marijuana is safe because I get it from my older brother. I said, where's your older brother get it from? Well, he's got a guy that he only gets it from this one guy, so he knows it's safe. And I stopped the questioning right there, because the next question was, well, where does that guy get it from? And you can go on and on. Unless you're getting it by prescription or some sort of a regulated dispensary, it's really just not worth the risk. Because I'm thinking, I haven't bought any, but I'm thinking that as it's become regulated and you can get it by prescription and through dispensaries and what have you, it may be costing less and people are using it more. So it's probably easier to get safe marijuana now than maybe it used to be.
Let's go through a couple of case discussions. We have a 75-year-old man with diabetes, history of hypertension, and hypertensive heart disease. And he's having trouble sleeping. And somebody told him that he should smoke a joint before going to bed. What would we advise this gentleman if we were counseling him in terms of marijuana use, and what possible effects he would need to avoid, given the slides that we've seen? Any thoughts?
The first thing is, do not smoke anything in bed. That is people smoke in bed and catch their beds and themselves on fire all the time. So that's the first thing.
What I would say, and it kind of links very closely to a question in the chat around peripheral artery disease, is of the things that we've covered already. Because you mentioned he's 75, he's got diabetes, and he's got heart disease, right?
Yeah.
So we already covered earlier that the cannabis and the THC is going to have issues with constricting your blood vessels, causing vasospasms, which that's not necessarily, might not be the best thing for you, won't be the best thing for your heart disease, especially if we're talking about uncontrolled, if either of these things are uncontrolled, right? Then we also discussed earlier that part of the relationship is around endothelial dysfunction. So the inner linings of your blood vessels are going to get rough, right? And when they get rough, things, when they pass by, lead to clots. Again, if you already have heart disease, and every time I'm saying heart disease, you can also substitute in peripheral artery disease, right? Because the mechanisms are the same. All of those things are going to be potentially exacerbated. And then we also talked about autonomic dysfunction. So autonomic dysfunction includes things like, making you feel anxious, making you feel panicky, increasing that, fight flight feeling. So while the intention might be to help my friend go to sleep, he can very easily end up on the other side of that, right? And get side effects that he didn't want when all he was trying to do was sleep. So I think one of the things that we've talked about, and I'm sure this is where we're getting to, is going to have to be a conversation that you have with your primary care provider, because just because you have these conditions, how well they're controlled, what dose are we talking about, how frequently do you want to use them, what other habits do you have, all of those things are going to play a role in how you make the patient, how you make this person improve their quality of life, right? Because not sleeping leads to poor quality of life. How do they get the improved quality of life and quality of sleep that they want?
Dr. Hines, I always love making fun of you because of your young age. I got a question for you. Do you remember a cartoon character named Dagwood and what he used to do?
I don't remember what he used to do, but I know I remember the cartoon character.
But given what cannabis does in terms of appetite, Dagwood had a sandwich he'd always make at midnight. All kind of processed food, bologna and hot dog, and they had a sandwich called a Dagwood.
We
And
just called it the Munchies.
what'd you call it?
Back in my day, it was just called the Munchies.
Okay.
So Dr. Maxey, do not be disparaging the name of Dagwood Bumpstead. You got to use his full name.
Yes, sure.
Okay, I'll be careful with him. All right, very good. Let's take another case. 17-year-old young man, senior student in high school, college bound, no medical issues, but him and his friends like to enjoy being high. And he's actually applying to go to school at in Boston and go to Tufts, New England. So what would we advise him about smoking? How would we counsel him? How would we start off with him? Maybe Dr. Nabor-Stephens.
At 17, they feel they know everything. And so you want to engage this person in an honest conversation with the goal of helping them to understand, one, what smoking does to their body. I'm thinking of a ad that was on years ago it was an anti-drug ad, and they had this skillet and they would drop an egg in it and they would say, this is what happens to your brain when you use drugs. Maybe it wouldn't be that graphic, but I would certainly try to get it across to them what is happening to their brain, what the risks are, and what the impact can be on their very bright future.
Very good. Any other thoughts going around the horn?
I would also, to your point about, I don't know that young people are as sensitive to scare tactics, but now that commercial, I remember that commercial, right? That series on this is your brain on drugs, and then you would hear the sizzle of the frying egg. But being real, especially because you said, I think this is also a time to talk to this person about the things that are of interest to them, right? So you said this is a 17-year-old college bound going to a Ivy League, school, right? So being clear that it can have impacts on your attention span, on your memory, slow your processing time, reduce your motivation, make your stress tolerance and your mood unstable, disrupt your sleep quality. So getting at making sure that the things that are important to this person are also addressed clearly, because some of those long-term risks when you're 17 or 18, I'm not gonna have a psychotic break. Like, that's not gonna happen to me, right? Or some of those things that's not how your brain works at 17. You're too immune to all of those things. But I think most people by 17, you have seen some people be slow. You have seen some people forgetful, say some stupid things, do some stupid things while they're high, and making the connection between the goals that you want and how those choices might get in the way of that if you're not careful how you use that, is another way that I would also think about having that conversation.
So I would add to point one about the experience your brain is having, and point two about how you may be functioning. I would add the risk of, you don't have to have alcohol. Dr. Hines mentioned this earlier. You don't have to have alcohol in your system to be pulled over for public intoxication or driving while intoxicated. Very famous news story a couple of weeks ago was Tiger Woods. He had no alcohol in his system and he was stopped for driving while he was impaired. And if you are going to Tufts and you have these significant academic goals and this future, you can have a very bad outcome by making a very bad decision while you are impaired. It's high and it's fun until it isn't. And so many people have made that one decision they can't get back. And anecdotally, it may only be one example, but don't be that one example of someone I know who was 17, was high, driving, and got into an accident, killed a friend of theirs,
Mm.
and it ruined everything. The friend's parents sued the driver's family. It became just awful in all the ways you can imagine it, not the least of which was the death of a good friend and profound trauma in the one who was high. So yeah, I don't know. I am not the best one because I don't drink and I don't get high. But I've seen enough people who drink and get high to know that you can live a real crazy life. Dr. Maxey and I spent a lot of time yesterday. He will tell you, I don't need any drugs to act silly. I have found a way to maximize my foolishness without the aid of any substances. And I think that most of us, if we to seriously think about the kind of person that we want to develop into with therapy and everything else, shedding those inhibitions in ways that are positive and are useful for you, being able to express yourself when things are bothering you, being able to work your way through anxiety with a therapist and with people that care about you, leaning into your faith life in ways that can help you. There are a lot of ways to not be inhibited and live your life without impairing your ability to make good choices.
Okay, I got one more case before we hit the top of the hour. 24-year-old female who has a 1-year-old that still is nursing, but she's also pregnant. And unfortunately, her husband just left her. So she has a lot of anxiety. And she's taken to vaping. Let's comment on her. What advice would we give her? Who wants to comment on her?
To be clear, she's vaping marijuana, not
Yes.
tobacco. Okay.
And she's not Chinese.
You lost us on that one.
What?
I said she is not Chinese.
What is there some protective
I'm
factor?
gonna before we answer, but before we ask Claire, let's not clarify. Let's just go.
Let's
keep,
just go past it. Thank you. Okay.
let's just
Let's go.
go.
That for those who are offended, that was just Dr. Maxey.
Yep, I don't know what the like, but we probably so let's just go. But so you said she's pregnant. She has a 1-year-old, and we anxiety, right? So that one, the things that I would focus on in that one is the part where so having dealt with many a pregnant patient, the goal while you're pregnant is to do everything you possibly can to grow a healthy human. And ingesting and vaping marijuana is not on the. It's similar to not smoking, not drinking, not using any other type of drug, right? It's gonna be in that same cohort of things that as best you possibly can while you are pregnant, right? Not to do those things. The other thing I would also say is that sounds like a big signal for help, right? So I am hearing an overwhelmed parent, right? And that is an opportunity to have a conversation about what is it that's what's causing your anxiety, and what are the ways that either clinically we can support you, engage with your community, whether you're, what are your resources that can help you with whatever it is that's causing the anxiety. Because here's the other thing, it's not going to get any easier once you have 2 little people. So we need some coping skills and some other things.
Find some
in
support.
that scenario, right? Like it could be any number of ways to deal with how, again, is the pregnancy whatever it is that's stressing you out. That's what I would suggest that we would talk about and focus on, because the not to steal thunder from my psychiatrist, you're just self-medicating there with the
Right. Right.
Yeah, the big problem I have often is that what you describe just don't have those kinds of things. Community support, psychiatrists, anyone else in the immediate area that they know how to get in contact with. This is where you can really help us. Some of our support organizations. If she's African American, you can talk to the Black Psychologists of America, or the Association of Black Psychologists, or Black Social Workers, so we can hook you up with some community support that's addressed that may be more available to you in your current situation. And the other thing to recognize is that medications isn't the only way to get support and to gain some sense of confidence and trust in this period of time. There's some communities, like we had in Austin, where we can have a partner or an aide during the pregnancy process that can help you to struggle and deal with this without you having the need to take some sort of medication to calm yourself down.
And thank you. We're at the top of the hour. Why don't we have our final comments, starting with you, Dr. Lawson?
Yeah, I just want to, again, I really want to, because I've just seen too many of these cases, really just want to emphasize you have to be careful with marijuana. The experience that's happening in Ohio and Hawaii and other places that became very legal, open in terms of making marijuana available, the results have been not immediately, but in the short, long term, extremely destructive to the community. We didn't talk about this, but there is a strong effort. I'm just disclosed that I think I'm one of the local radio stations temporarily blackballed me because I talked against their use of marijuana as a resource to help bring wealth to the Black community. It is sure you can bring wealth already, but marijuana shops are very useful. They do increase the likelihood of criminal activity, as well as cost of having of having needed mental health and substance abuse services. So marijuana can be very, very helpful for selective individuals. I found it very helpful in terms of folks that have problems with anorexia and so forth. But on the other hand, there's over 30 different cannabinoids. Better be very careful which one you're taking. And most importantly, make sure you're taking cannabinoids and not fentanyl or whatever else that may be in it. And we hinted at this. There's, at least locally, I've found several places where folks, under the guise of cultural awareness, coming up with products that they say are part of their culture, yada, 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 but which end up with some of the more dangerous types of agents. So marijuana can be useful under controlled circumstances, should be avoided in anyone who is not an adult, and can be helpful for folks that sometimes the standard sedating agents, pain-inducing agents, aren't that helpful.
Thank you so much. Dr. Hines?
So when I was coming up, marijuana was bad, right? It was the gateway drug. And if you use marijuana, it was going to take you down the path and you're going to have a horrible life, right? We have evolved past, that marijuana is just good or bad, right? There's a lot of nuance that nobody was talking about when I was younger. But a lot of our current thoughts, and I say that because a lot of our current thoughts about marijuana are based on incomplete and inaccurate information. And so as we are thinking about how you want to engage or not engage, or how we want our loved ones, friends, family, etc., to engage or not engage with marijuana, I think maybe taking a risk stratification approach is probably more appropriate, right? And that's thinking about, well, who's using it and how often and what doses and what are the underlying vulnerabilities. And that is where the conversation can really get at some clinically meaningful, is this a good choice for you as an individual? as opposed to just it's good or it's bad.
Thank you. Dr. Wilkes?
Thank you, Dr. Maxey. I think that when things become legalized, when people say it's okay to use it, we sometimes forget that moderation is important all the time. And just in terms of thinking about this, I think about marijuana use, or let me say THC use, the way I would think about alcohol. Just because it's legal doesn't mean you can just use as much of it as you want and go and do everything you want. After you've had a drink or two, there are a lot of things you should not be doing. And if you're going to be smoking marijuana, or you're going to eat up a bunch of edibles in some form or fashion, you need to put the same kinds of protections in place, because it's going to affect your ability to make the best decision at the time that you are under the influence.
Thank you, Dr. Wilkes. Dr. Barbara Davis-Stevens?
I would like to end with the thought and the emphasis on, and it's not unique to the subject that we're discussing today, but especially this subject because it's achieving a legitimate status with legalization in a lot of places. Please, please, anyone who is using marijuana needs to seek information from valid, reliable sources. The internet and social media is not the place to get your information. I cannot say that enough.
Thank you so much. And I'd like to warn young people especially. My parents used to tell me when I would go to parties, don't drink out of the punch bowl. Don't let anybody make a drink for you. If you have a drink, make sure you you open the bottle and pour your own drink. Be careful. You don't know what people put in things that they think will make you have more fun. So just be careful of what you put in your body. And lastly, I'd like to say that,
Dr. Maxey,
yes,
make a quick point that, again, right now, RFK Jr. and his group is promoting the use of more research in psychedelics.
yes,
I've been involved with that research. The development is showing that ketamine is a very effective treatment in terms of depression and suicide. It's been very useful. There's excellent work with psilocybin, especially in terms of treating of depression and PTSD. So something saying that some of the agents that we're looking at in terms of the psychedelics, I think are going to be very, very helpful in addressing specific mental disorders. But at the same time, I think making these agents available is also going to add to the risk of inappropriate use and other risk factors that we have yet to be determined.
yeah. In fact, they just signed an executive order 2 days ago. The president did,
The fast track.
like reclassifying a lot of these drugs so they can do research on them. But thanks everybody for being here today and with us. Thanks for spending part of your Sunday afternoon with us. Thank you, Simon, for helping. Everybody have a great Sunday afternoon.
Good day, everyone.
Bye.
Take care.
Bye-bye.